In dentistry, there are several types of dental crowns, each with its own unique properties and indications. Dental crowns are used to restore and protect damaged or weakened teeth. The choice of crown type depends on various factors, including the tooth's location, the amount of natural tooth structure remaining, aesthetic considerations, and the patient's budget. Here are some common types of dental crowns. Porcelain crowns, all ceramic crowns. These crowns are made entirely of porcelain, providing a natural tooth-like appearance and excellent aesthetics. They are often used for front teeth or other visible areas of the mouth. Porcelain crowns can be matched to the color of the adjacent teeth for a seamless look. They are a good choice when aesthetics are a top priority. Porcelain fused to metal, PFM, crowns. These crowns consist of a metal substructure with a layer of porcelain fused to the outside. They offer both strength, from the metal, and aesthetics, from the porcelain. PFMs are often used for molars and other posterior teeth, where strength is crucial. Metal crowns. Metal crowns, such as gold or silver, amalgam, are known for their exceptional durability and longevity. They are less commonly used nowadays due to their metallic appearance, which is less aesthetically pleasing. Gold crowns, in particular, are still used for some cases, especially for patients who prefer their unique characteristics. Zirconia crowns. Zirconia crowns are made from a strong, tooth-colored material called zirconium dioxide. They are highly durable and are often used for both front and back teeth. Zirconia crowns can be matched to the natural color of the teeth and are less likely to chip or fracture. Stainless steel crowns. Stainless steel crowns are often used in pediatric dentistry to restore primary, baby, teeth. They are pre-made and can be placed quickly to protect and preserve a child's tooth until it naturally falls out. Resin crowns. These crowns are made of a dental resin material and are typically used as temporary crowns. They are not as strong as permanent crowns and are usually used as a temporary solution while a permanent crown is being fabricated. Ceramic crowns. Ceramic crowns are similar to porcelain crowns but may have different properties and manufacturing processes. They are used in various clinical situations and can offer excellent aesthetics and durability. The choice of crown type should be determined by your dentist or prosthodontist, taking into account your specific dental needs and preferences. Factors such as the location of the tooth, the condition of the surrounding teeth, and your budget will all influence the selection of the most appropriate dental crown type for your situation.